Hi, it's Dr. Yetter. I want to talk to you a little bit today about one of the most common complaints that I see here in the office on a daily basis, and that's heel pain, or in other words, plantar fasciitis. It's really is one of the most common things that patients complain of when they come in. Oftentimes it's right on the bottom of the heel, hurts in the morning when they first get up, and hurts with their first steps in the morning, and as it warms up, it starts feeling better. Often presents after long periods of standing, walking, or being up and about all day long. It starts feeling worse, or at the end of the day when they sit down, finally take a rest and then get back up, they tend to have excruciating pain again right on the bottom of the heel. Less commonly it's found in the arch, but more so in the bottom of that heel. In fact, if this is your foot here, most people are going to feel it right in this area, right on the bottom. Not so much along the arch. It does happen along the arch, but it's mostly on the bottom of the heel. Now, one of the biggest complaints or biggest issues that I see that lead to plantar fasciitis or heel pain is the improper shoes that people wear. Here in Southern California, most of us like wearing sandals, which do not provide much arch support, and therefore do not support that plantar fascia along the bottom. That leads to like an overuse injury, could be micro tears, little small tears in the plantar fascia, or just inflammation from lots of standing, walking in irregular surfaces, flat surfaces and hardwood surfaces or hard surfaces in general will cause this to feel worse. So what I typically recommend, and this is for some at-home treatments, is basically icing, lots of icing, at least 3 times a day. Stretching, stretching the calf muscle, stretching the plantar fascia along the bottom of the arch. But one of the biggest things and most important things is the shoes, like I said, that people wear. Sandals is a big issue. Any flats, people being barefoot, flat sandals, those are going to cause problems. And if you have plantar fasciitis and you have heel pain and you continue to wear these things, it's not going to get better. It's really going to fight against the treatment. No matter what you or I do for this to treat this, it's going to fight against the treatments that we're doing to try and get this to feel better. So what I recommend is a good supportive shoe, like a tennis shoe. Not very fashionable, especially if you're wanting to be at the beach a lot or just walking around in the hot summer. You're going to want to wear sandals, but the reality is this will likely continue to be painful until you switch shoes, until you start supporting plantar fascia and give your plantar fascia a chance to calm down and heal, and let the inflammation that's deep within go away. So custom orthotics, or even some over-the-counter orthotics that are rigid, that are not really flexible, those are going to support the arch the best, but a good pair of tennis shoes will help in most cases. The basic 3 things, like I said: icing, stretching, and wearing good supportive shoes. That's not necessarily all that needs to be done sometimes, especially if you've had the heel pain for a long time, but that's a start, and that's something also that can help prevent reoccurrence and can also help prevent occurrence for the first time. But anyways, that's one of the most common things we see in here, and it really comes down to a lot of times the shoes. And so I encourage you to be mindful of the shoes you're wearing. If you start feeling some pain along the bottom and you've been wearing sandals quite a bit, before it really starts flaring up and becomes a real major issue, give those sandals, give those, for women, give flats a break. Avoid barefoot as much as you can, and even in the house, I even encourage my patients, when they really are in pain, to not walk barefoot in the house, because those hardwood surfaces are going to do you a disservice to your plantar fascia. It's going to irritate it more, and it's going to cause more pain, and it's going to take longer to heal. And as this becomes a chronic issue, the longer it's been there, the harder it is to treat, harder it is to have all your symptoms resolved. So anyways, that's just a quick bit on plantar fasciitis. There's other things that we do for it, such as cortisone injections, anti-inflammatories. There's also some things that you can buy online, or that you can get through the office here. There's splints that you sleep with at night called night splints. They really are fantastic, and they're probably annoying to wear, but they do work quite a bit, especially when you get up for that first pain, for those first steps in the morning when you first get up that are painful. It really helps with that. But anyways, if you are having problems and it's not seeming to get better, and you're icing it, you're stretching it, you're wearing good shoes, come into the office, and we'll see what other measures we can do to help kind of take care of this problem, get you back on your feet again without pain.